I still get letters, and I'm going to read a couple of them, about people who are, anti-vaccine and all that. And all I can say is we report the facts of COVID here. That's what we do. And then you can decide what to do with those facts. This Delta variant of COVID is more contagious than the original. It's obvious. 95% of the people who are getting the Delta variant are unvaccinated. That's it. Now, if you won't believe that, I don't know what to tell you. Those are hospitals reporting to Atlanta. All right, and the hospitals do their due diligence when someone comes in. So if you don't believe it, then you don't believe it, but it's like saying there are 4 seasons. Well, I'm not going to believe that. Okay, fine. So the Delta variant now is whipping around this country, and the people who are not vaccinated are getting it and spreading it to other non-vaccinated people. There are some vaccinated people, particularly with the Johnson & Johnson vaccine, that are getting it, but usually a very mild case of it. Okay? So that's the fact. That's your baseline. But now we have a big problem in children. All right? What are we going to do when the kids go back to school and some of them are already in session? Are you going to make them wear masks? So I asked my staff, and they did a very nice job of this, to get some stats, and we got them from the American Academy of Pediatrics. So at the top of the line. So stat number 1 is that of all the cases of COVID since the beginning of the pandemic in the USA, children comprise 14%. That's under the age of 18. Okay? So that's a very low number. 23 states have reported children being hospitalized because of COVID, but 27 states have had not one child in the hospital. That stat is pretty amazing. Okay? According to the CDC's COVID data tracker, as of August 8th, and today is the 9th, so that's yesterday, 3% of children ages 12 to 15 are vaccinated. That's all. But they're not getting COVID or the Delta very much so far. Only 2%, ages 16 to 70, are vaccinated. So that's 5% altogether of kids under the age of 18. Remember, if you're under the age of 12, you cannot get the vaccine because they haven't done enough studies to see if it's worthwhile or not. So the fact is that at this point, children are seemingly resistant to the worst parts of COVID. And those who do get it like the flu. So in the UK, they did a study on the kids, 5 to 17. This is from the Lancet Child and Adolescent Health Journal. It said most children with COVID recover within a week. It's like the flu. But now you've got this hue and cry to have the kids masked up in school. So I wanted to talk to one of the best experts in the country about that. And he comes to us from Nashville, Tennessee. Dr. William Shaffner is a professor of infectious diseases at Vanderbilt University School of Medicine. First of all, in the stats that I just gave, did anything strike you, stand out?
Well, I have a great deal of respect, Bill, for the American Academy of Pediatrics, but I was surprised that a substantial number of states have not had any admissions of children for COVID to their hospitals. That seems anomalous.
27.
I would like to explain that.
27?
Yeah, well,
that caught my eye too. That caught my eye.
Because what's happened here in Tennessee just recently, let me give you just 3 quick numbers. In early July, we had about 4 children in all of the hospitals in Tennessee admitted with COVID. Mid-July, it went up to 17. And as of Friday, it was 27. So it's clearly increasing. And some of those children are in pediatric intensive care units, which is pretty darn unusual. Our commissioner of health, who's a pediatrician, is really worried about this.
All right, so you went from 4 kids to 27 kids with this variant. And those are
Okay.
human beings under the age of 18, correct?
Correct.
Okay. So that's still a very small number of the population in Tennessee. You're not, and remember, again, I'll remind everybody, 12, birth to 12, no vaccine. Okay, you don't get it.
Right.
But when there's an article in the Wall Street Journal on the op-ed page by two esteemed doctors, and we checked them out, and they're very, very, credible. They say that wearing a mask in most situations does more harm than good to the student, especially the teenage student. It's more harm than good. So that the cure is worse than the disease here. But you don't believe that, do you?
Well, first of all, let me tell you, of the two, I know one of them pretty well, and I do respect him. But his view is very different than that of the American Academy of Pediatrics, which undoubtedly your staff has told you has recommended that every child who goes to school should be wearing a mask this fall. And I certainly agree with that. And the pediatricians here at Vanderbilt certainly agree with that. So, yeah, I would
But
have a
if the
difference.
transmission level is so low now, why and 27 states don't have any cases. In those states where there isn't a lot of Delta or COVID in general, why would you impose that on children?
Well, first of all, I'm not sure about those numbers. I'd have to look at that again. Happy to do that with you sometime, and the AAP. But I think what we're trying to do is prevent cases. We don't know how much transmission is occurring. We can hold two thoughts in our mind at the same time. There may be a fair amount of low symptomatic spread that's not being tested, relatively few people getting sick. But as children come together in schools, what we want to do is avoid an explosion of cases in schools across the country. And of course, there are a number of ways to do that. Everybody who should be vaccinated. And then what we do is, in addition, put another layer of protection out to reduce transmission, particularly to the youngsters.
I disagree, and I'm not a medical person. I'm coming at it from a more of a common sense point of view. So what I would do if I were the governor of any state, I would allow each school district to make the decision, and then parents would be involved in that. So if you wanted your child to wear a mask, then the child could wear the mask. But if you said no, the child didn't have to. I would require teachers in the classroom to be vaccinated. I would absolutely do that, all right? And any adult on the campus would have to be vaccinated, because you just don't want, you want to cut down any potential danger. And I would also require, in a school district that has a spike, or a school district that has a school itself, that then it would change. And then the principal could say, public health, we'll have to wear masks, or we're all off for the week. Wouldn't that be a little bit better than one size fits all, pardon the pun?
Well, first of all, we're a little bit closer than you might think. I like everything you said, and I would add something. If the local health department determines that there's a high rate of transmission in that community, then I think masks ought to be obligatory in
No
those
argument
schools.
from me. If there's a high rate of transmission and a public health alert, which these people should be getting out. But otherwise, doctor, you're talking about the flu. So every year, kids get the flu, and they're in the schools, and as the British study showed, 5 days are out of the flu, and the downside of the mask is substantial. Last word.
Well, I don't think the downside of the mask is very substantial at all. And we have to remember, every child who's infected and gets sick, for that family, it's 100%. There've been over 300 children that have died of COVID in the United States. We can keep that number even lower if, we don't want it to grow. We want to keep that number as low as possible.
All right, Doc. Thanks for taking the time. I really appreciate it. It was very nice to talk to you.
Thank you, Bill.
Fellow Americans, I am concerned about the U.S. dollar. Huge debt, as you know. Will it stay as the world's reserve currency? That's why now more than ever, I recommend you diversify with gold and silver. And the only company I recommend, and have for years, is American Hartford Gold. I trust them. I've personally done business with them. They sell physical gold and silver delivered right to your door or put inside your IRA. And they make it very easy. So call them right now. Make sure you tell them Bill O'Reilly sent you, and they will give you up to $2,500 of free silver on your first order. Since I have been recommending American Hartford Gold, gold shot up more than 40%. Silver, more than 60%. So don't wait, call them now, 866-501-5201, 866-501-5201, or text BILL to 65532. Again, that's 866-501-5201, or text BILL to 65532. Bill O'Reilly here. Thank you for watching this video, and make sure you subscribe to the First TV YouTube page. Just hit the big red subscribe button below, and you'll get clips and highlights of my program, The No Spin News, every single day. We'll see you soon.